So far in Massachusetts, the state has confirmed more than 100,000 cases of COVID-19, along with almost 8,000 fatalities. But the spread of infections has fallen more heavily on certain groups, including the state's Latino population. A report on that impact has just been released by the Gastón Institute for Latino Community Development and Public Policy at UMass Boston. We'd like to welcome two of the UMass professors who co-authored the report, the Institute's director, Lorna Rivera, and Dr. Eduardo Siqueira. Thank you both very much for being with us. I want to start with Dr. Siqueira because looking at least the statewide view here, how big is the disparity as far as it affects the Latino population in Massachusetts?
What we are seeing is what we expected to see once the data became better in terms of quality, in terms of identification of race and ethnicity. And what you're seeing is the number of cases of Latinos may be 3-4 times higher, depending on the neighborhood. But in general, there's an excess of cases compared to whites, even to African Americans, a higher number of Latinos infected. And I'd also emphasize that this number is probably still an undercount because there are populations that do not easily fit into this group, and I'm specifically speaking on behalf of Brazilians. I know there are a number of Brazilian cases, and we do not know how they identify in the forms. So I would say there is an undercount. But the picture is very clearly what we are now seeing very clearly also at the national level. The CDC just released a report showing that the number of cases in Latinos is much higher all over the country as expected. Not necessarily in fatalities, but in number of cases, absolutely. And now that the epidemic reached heavily populated Latino states such as Florida, California, Texas, Arizona, then the numbers skyrocketed for cases of Latinos. And the same situation happened here in Boston and Massachusetts before.
Turning to Dr. Rivera, you're also on the Mayor's Task Force on Disparities. What do you see in Boston if you go down to the neighborhood level?
Well, we see what have been some very underlying both conditions in terms of chronic health conditions in our population in Boston, and particularly puts you at risk like asthma and diabetes and hypertension. And we have Boston Public Health Commission has studied that issue to show how our residents have significant health disparities. But as well, if you look at our housing situation with high rents in Boston, families double up, individuals live in more crowded homes, and we have to also deal with that population density as well as making putting people more at risk. And the high poverty rates, particularly for Latino children in Boston, are significantly higher than for whites. And so all of those factors come together to have a particularly devastating impact in Boston for Black communities as well as Latinx communities.
Turning to Dr. Siqueira, because the Latino population overall is younger, the fatality rate itself wasn't quite so high, but how would you describe the impact here? Because it seems to me this isn't just about COVID-19 itself. This is how COVID-19 aggravates other problems, isn't it?
Well, there are two main issues we should be concerned about. Number one, and I'll start with the one that's being less spoken about, which is the sequelae. This disease, this virus, leaves behind damage to several organs in our body. So the fact that people don't die doesn't mean that they'll be healthy after the disease. It could be the lungs, it could be the kidney, it could be even your brain. So we are seeing more and more, and now people are starting to see more and more cases that go for a very long time, as well as other effects of the virus. So that's number one. And the young population did not die as much, but let's wait to see what happens with the sequelae. The second issue is we know for a fact, this is worldwide, younger populations do not have as much number of serious cases as populations that are older. That probably explains why for Latinos, the case fatality rate is much lower. Having said that, we are now seeing Texas, California, Arizona showing us younger folks actually with very serious cases. So I will probably hold on this decision if this applies to all Latino population in the United States. Because in those states, I'm watching what's going on. Physicians are noticing that very serious cases, not necessarily in terms of numbers, but very serious cases that show that younger populations can also be affected. And once you have a younger population, such as the ones we have in Florida and Texas, what you're gonna see is the number of deaths of younger Latinos also increase. So I wouldn't make a final statement about this virus is not as bad for younger population, because one of the issues is what is the composition of the population in the first place. Massachusetts is not a good case in point for us to say anything about that. On the other hand, Texas, California, Florida, yes, then we'll have a more definitive answer about this issue.
Dr. Rivera, one other disparity in the works here is the poverty level. It is higher for Latinos, and when people have less money, they're more likely to be cooped up in a household with more family members living together. East Boston, I think that was an issue. East Boston had the highest infection rate. People there were saying maybe there should have been more done to allow alternatives so that people could isolate. Should that have been the case?
Yes, absolutely. You know, I think looking to the city of Chelsea as an example, immediately dealt with the situation by, you know, having some of the hotels, the local hotels provide, you know, some of that housing. But again, I think there's been a lot of fear still in many of our particularly undocumented communities in getting testing, in accessing some of the healthcare that they need, because despite the fact that it isn't the case that it would be counted towards a public charge, there still is this fear in the community that if you access public services, it could, you know, impact your green card status and other, you know, so-called public charge policies. So even if we had all the cases identified, it still is an undercount to Dr. Siqueira's point. And you know, what more we need to be doing more, just with the testing, as well as once people have tested positive, right? Where can we get them, you know, to quarantine safely and have the appropriate supports even there. For example, in Chelsea, the hotels, some of the local businesses and Latino caterers mobilized to get, you know, culturally appropriate food for the families that were not quarantining in their own homes. So it takes a lot of care and consideration and again, multilinguistic approaches to accessing these very vulnerable families.
Dr. Siqueira, we're talking about a population that is more likely to have to go someplace to work and maybe get there on public transportation, and adding that to language barriers. So what do you need to have adequate testing and contact tracing?
Absolutely. I don't think Massachusetts did a great job on this, but compared to other states, we're much better. Now we know for a fact. But I would say that contact tracing requires a lot more than what we are seeing on the ground. Contact tracing through the phone is not only what we need. We need to be door knocking. We need to be canvassing, knowing where the virus is by doing the correct testing. Then you isolate, and you actually have to do the footwork to actually go to where people live, give them instructions correctly, which means it has to be culturally correct, adapted to the culture of the different populations, and a lot more people on the ground. And I'm not seeing this. So I'm also concerned that with the reopening of the economy, as we are seeing, and given the fact that the epidemic is not controlled in many states in the United States, we probably will have a second wave. And I don't see enough preparation for the contact tracing to be done the way it's supposed to do. And the second issue is there is a component of contact tracing that is beyond the individual's so-called freedom to decide if they're going to wear masks or not. This, in every single pandemic, some measures have to be in place for people to understand that they don't have much of a choice to decide if they're going to wear masks or not. They must. And the must mean you have to have a lot more people on the ground to make sure that this happens. It's not necessarily a police kind of a mentality, but it is a persuasion with some threat. Because without the threat, people decide, no, I'm not comfortable, I'm not going to wear it. But the virus is not your personal property. You do not decide about the virus as it belongs to me. It does not belong to you. It's a social issue. And we have to have social rules to make sure that we control the virus.
Dr. Rivera, one of the other recommendations in this report is to have universal health care, even for unauthorized immigrants. I'm sure you're all aware that there is some strong political resistance to that, but why is it so important, at least from a medical, epidemiological standpoint?
Well, particularly in the case of Latinos, is just the acknowledge that we could deny these services, but the communities are here. There are neighbors, there are co-workers, and we need to take care of each other because this is a public health issue. And, you know, I think that it's also a matter of, again, you know, understanding that that many of the Latino workers are in the jobs, these essential jobs, that are putting them at greater risk. And this is grocery stores, food, health preparation, you know, healthcare aides. So we rely as well on immigrant labor for our daily needs, all of us. This country was built on the labor as well of immigrants. And so, yeah, I think it's a matter of justice, but it's also just a matter of protecting all of us in our communities from the COVID and other viruses.